Today I want to discuss with you the mortality rate of children across the globe. At the conclusion of my presentation, you will be informed on the risk factors causing the high child mortality rate and some interventions that have been identified to help combat these high rates. Children all over the world are dying at astonishing rates. Because of this, the World Health Organization has recommended some simple interventions in the attempt to help save the lives of these children globally. In 2007, the World Health Organization released a report called Global Strategy for Children's Health. The report indicates that the astonishing rate of 9 million children die globally under the age of 5. The report also cites that 70% of these deaths are treatable or preventable with these simple interventions that they're recommending. The World Health Organization has made the recommendations to decrease the global child mortality rate and plans to monitor the success of these recommended interventions and provide a follow-up in the year 2015. My name is Amanda Thomas, and I'm a registered nurse. And as a registered nurse, I'm concerned about the health of children, not only in the United States, but also the health of children throughout the world. The World Health Organization is an entity that monitors the causes of illnesses and the death rates among children globally, as well as other matters pertaining to health and disease. They take this information and from that determine interventions that can help reduce these rates. Today I want to tell you about the risks children face and what interventions have been recommended to reduce the mortality. So now we'll look at who is at risk and what recommendations have been made. The highest risk of death is in neonates, which is children 1 month of age and younger. The main causes of death for these neonates is preterm birth, birth asphyxiation, and infection. Interventions recommended to combat these causes are providing access to quality prenatal care, having skilled attendants at birth, and providing immediate neonatal care, focusing on the child's physical needs as well as the nutritional needs. So now we have looked at neonates. Let's look at the children from 1 month of age to 5 years. For children 1 month to 5 years of age, the main causes of death are pneumonia, diarrhea illnesses, malaria, measles, HIV, and malnutrition. The World Health Organization reports that 2/3 of these deaths from these illnesses can be prevented with the practical low-cost interventions. These interventions include access to medications such as antibiotics and oxygen for pneumonia, oral rehydration salts with zinc for diarrheal illnesses, and antiretrovirals for pregnant mothers with HIV. They also recommend insecticide-treated nets for malaria in high-risk countries such as Africa, and intend on combating malnutrition through encouragement of breastfeeding and education of nutritional needs such as highly fortified foods and energy-rich foods for children starting at the age of 6 months. The final recommendation of the World Health reports addresses vaccines. Vaccines play an important role in preventing the death rate or lowering the death rate among these children. The Department of Human Services Center for Disease Control explains how vaccines prevent deadly diseases in a 2009 report called How Vaccines Prevent Disease. The report states that that antigens or parts of antigens are taken from these diseases and made into a vaccine by taking a killed or weakened form of them and then injecting that into the person. Once that's injected into the person, the body forms antibodies to help fight against the disease. And then when that person comes back into contact with the disease in the future, these antibodies protect them from contracting that disease. So increasing the availability and distribution of vaccines such as measles, polio, DTaP, and the flu vaccine are proposed to help reduce the risks to these children greatly by reducing or preventing the deadly illnesses they're faced with. My intent is not to scare you, but rather to inform you that these dangerous risks are prevalent in today's world for these children. So today we've reviewed that neonates are dying from lack of proper medical nutrition and education, that children 1 month to 5 years are dying from disease and malnutrition, and vaccines can aid in saving the lives and preventing deadly diseases of the children that the children are faced with. Now we will leave today informed of the risks the children encounter and the interventions that have been recommended by the World Health Organization to help decrease these mortality rates globally. It is the hopes of the World Health Organization that this plan will become successful in reducing the 2007 death rate of 9 million children under the age of 5 yearly. As I mentioned previously, the World Health Organization will continually monitor these recommendations, the recommended interventions, and plan to review the data and see how successful they were in the year 2015. At that time, they compile the data and a report will be issued on the success or failures of the recommendations. I look forward to the countdown of 2015 in hopes that these recommendations are successful in saving the lives of children globally.